starting lunchtime on the East Coast. I hope everyone's having a good day. I see some AIDPH fellows and participants of past programming here. As folks come on in, if you're able, I invite you to come on camera. This is a didactic presentation, but we designed it to be as interactive as possible. So we would love for you to be engaged and on camera if possible as we go through our discussion here today. Thank you again for taking time out of your day and joining us to talk about veteran oral health in North Carolina. We're very excited to be here and be doing this presentation with all of you today. I'm Liz Flannery. I am the Director of Education and Leadership here at AIDPH, and I will be your presenter today. So without further ado, I'm going to get started. I'm going to give us a national overview of veteran oral health before we dive into the data and look specifically at what is going on with veteran oral health in North Carolina. As I said, we have several points for discussion woven throughout the session, so I hope you're ready to engage and share your thoughts with us. We want to leave you with next steps and action items after we look at the data and look at maybe some of the disparities that are happening in North Carolina. So we will have action items and next steps, as well as pieces, logistical next steps about how to share out this seminar, how to get your CEU, etc. A few housekeeping pieces. We are recording this session. We want to engage with discussion, but ask that you stay muted until it's time to discuss. We also, in addition from hearing from you, we want to make sure that we're giving space for you to connect as stakeholders in North Carolina with folks in your state. So please do that in the chat. We invite you to introduce yourself, share your name, your email, your organization in the chat as we go along and talk about veteran oral health and ask to hear from you. It would be great if you are working on veteran oral health, if you share that out with your colleagues in the state. We find that it's a great way for folks to share out their work and make connections to amplify the work that they're doing in veteran oral health. Okay. I mentioned engagement. The platform that we are going to use for engagement today is Slido. If you have not used Slido before, it's fairly straightforward, and you can access that in a few different ways. You can grab your phone and scan the QR code here. If you want to pull it up on your computer, you can type in slido.com and use this access code that's on the screen here. Shayla's going to also type that access code into the chat so that we have that as we go along. Once you pull this up, please keep it up because we are going to use it throughout the session today. Okay, I saw a few cameras coming up, a few phones, so I will just give a second for the QR code there. Okay. These are our learning objectives for our session here today. These are tied to our CEU. They are available in the registration materials. They will be available on the LMS where we will post the recording for the session here today. Okay, so we're going to get started. We're going to kind of make sure that we can all access Slido and kick us off with some level setting and sharing out. So if you haven't already, toggle over to Slido. We're going to start with a poll about what brought you to the session here today. Did you come to learn, to share, to connect, or to act? And maybe it's all four of those. Okay. I love that we're learning and all of the above. That's really fantastic. We'll have to do a check-in at the end and see if you felt like you've learned something. And again, we'll leave you with action items. We'll give folks a second to make sure that they can answer. I'm seeing us staying steady here. I'm going to toggle back over to our slides. But if you haven't had a chance to answer the poll, please continue to do so. The poll will stay open even though I don't have them on the screen. Okay. Again, I am the presenter for our session here today, and I do not have any disclosures to share. And I introduced myself. I also want to highlight that my colleague Shayla Stewart is with me on the call today. Shayla will be monitoring the chat. If you're having any Zoom issues, she can help you. If you have any questions, please post them in the chat. She'll interrupt me and chime in. And again, is also helping manage our Slido and our Q&A pieces there. We want to take a minute and say a big thank you to the folks at Oral Health, the North Carolina Oral Health Coalition. Without this team here, we wouldn't be able to have this seminar. They worked very closely with Shayla and very diligently to share this out with as many folks in North Carolina as possible. So we want to say a big thank you to all of you for sharing this out, for amplifying this work, and making sure that folks in North Carolina could come together for this seminar here today and talk about this important topic. We are also going to, as we end with next steps logistically and in an advocacy perspective from AIDPH, we're also going to hand it over to the North Carolina Oral Health Coalition to talk about how to engage locally and with the coalition to stay activated. So we'll hear a little bit more from them at the end of the session here today. Okay. So we're going to go to Slido one more time. And before I really dive into the didactic presentation, we would love to hear from you about what you believe are the top priority areas for veteran oral health in your state. So that might be access to care, it might be oral health literacy, workforce development, policy advocacy, integration with general health care. This will also be helpful for me as I go through. We can kind of tailor what we're talking about here. And if you did not yet pull up Slido or you accidentally closed it out, the QR code is on the screen here again, or you can just go to slido.com and use this access code. Okay. Access to care, integration. We will talk a lot about integration. Access to care is definitely our overarching theme. I would say I think it's hand down 100%. We have been able to do this seminar in more than half of the states in our country so far, and hands down access to care is always the number one on this poll. It's always the biggest issue. Oral health literacy, workforce development. Okay, so we're definitely going to talk about those pieces. The oral health literacy piece, I'm always curious what population that lies with. Is it the veterans themselves? Are there some other community partners that need help with that oral health literacy piece? Does it tie into that medical dental integration piece? If folks have thoughts and want to share that in the chat, I'd love to hear that. Okay, so again, if you have not yet responded, please continue to do so. I'm going to toggle us back to our slides, but if you haven't responded to the poll, please do so. It will remain open. All right. So a little bit about who we are at AIDPH. How did we get here? Why are we giving this presentation here today? AIDPH is a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. And you'll see all three of those through our time here today. We're really looking at the research that we did in veteran oral health and pulling it into an educational piece and talk about the advocacy work we've been able to do and the way folks can activate with advocacy based on the data in your state. We do this work because we have a vision of a justice-oriented oral health system. We have 4 communities of focus at AIDPH, which includes LGBTQIA+ people, veterans, people with disabilities, and people living in rural communities. Obviously, today we are focusing on veterans, and we understand, of course, that there's intersectionality amongst our 4 communities of focus. For example, what we're talking about here today, approximately 30% of veterans report having a disability, and approximately 25% of veterans live in a rural area, something that we'll talk about and do a deeper dive into in our session here today, understanding that when there's that intersectionality, it can increase those disparities that those communities are facing. Okay. We want to take a moment and say thank you to CareQuest Institute for Oral Health. They have been a deep partner on our work in our veteran oral health research, which you'll see in a second here, and also are the funder for this seminar series, allowing us to go out into local communities and share out the resources that we've developed in partnership with them. So as you can see here, this is just a timeline of our research in veteran oral health. It really started with the question of what do we know about veteran oral health? And Annalise Cawthorn, our executive director and co-founder, she will always share. She happens to be the spouse of a veteran, and the story that she shares is she was asked this question and embarrassed to admit that while she was the spouse of a veteran and received her own health care through the VA, um, said not much. I think it filled less than half a sheet of paper of what we knew about veteran oral health. So, really understanding that there was a need for more information and a really large data gap, that was the impetus to starting our research. We started it in a community engaged manner, working with veteran service organizations to hear from veterans themselves in the design and implementation of our research. And it really snowballed from there, leading to more research, allowing us to take findings and bring it to Senate testimony, to lead Hill Days, to kind of advance the advocacy effort around the disparities we found when we were able to start that research and really dive in. Okay. So that's a little bit of the story behind our research. And so let's talk about what the research shows. We're going to start with a national overview. Again, to level set and kind of understand the national scope before we look at things on the state level. And this might be familiar to some of you, but what we found over years of doing this work is that many people, sometimes including veteran themselves, aren't fully aware of how VA medical and dental benefits work. That's really why we like to start with setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So I'm going to go over two key points over the next two slides. The first one here is that eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, and where it can be delivered. And because of that, any major change, like expanding dental coverage through the VA, would require congressional action. So it's not just a policy update or a rule passing, it involves passing new legislation and then securing the federal funding to support that legislation. So when we're talking today about the limitations in access to dental care for veterans through the VA, it all ties back to laws at the federal level. At the same time, I want to point out that that doesn't mean that we can't take action and impact change at the local and state level. It takes first getting educated, like we're doing here today, and kind of understanding the need. And then it takes collaboration with our local communities. And after we go through your state data, we'll share some legislative wins that happened at state levels across very different states as examples of pathways for increasing access to care. Okay, so the second point here is that most veterans are not eligible for dental care through the VA. So if you look at this graphic here, the top row of people you see represents all 18 million veterans living in the US. The lighter colored half shows the veterans who either receive care outside the VA or aren't eligible for VA healthcare at all. And then as you move to the left of the chart, the darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. And then of that 9 million, only a tiny fraction, that small blue and red segment, is actually eligible for dental care through the VA. And then additionally, so that equals out to about 1.8 million veterans who are eligible for dental benefits, and only about a third of them actually use them. So we need more information and more research to understand that utilization rate, but we suspect that barriers to care and lack of awareness play a big role from our conversations and our work in this community anecdotally. And we'll look at some pieces around that as we look, do a deeper dive into the data. Okay, so ultimately, this means that veterans can be going and getting their health care at the VA, but leaving with untreated dental needs, leaving with potentially dental pain. And we know that that problem is even worse for veterans living with chronic conditions, where good oral health is especially critical to the health outcomes. So we're going to look at that a little bit more. So, veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. And again, this might be familiar to some of you delivering clinical care. What's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poor oral health outcomes for veterans than non veterans, even if they've seen a dentist in the past year. And so, what this tells us is that access alone isn't solving the problem. Even when veterans are getting dental care, many still face some of the worst oral health outcomes. And a reason for that, going back to the poll that you just took a few minutes ago, is the lack of integrated care. So I know that that came up as an issue area for all of you. The chronic conditions aren't being addressed in coordination with oral health needs. That's especially frustrating because the VA is the largest integrated healthcare system in the country, and it's really uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care point, which really leaves major gaps in their overall health outcomes. Okay, diving into this a little more specifically, this is from recent research from AIDPH that, again, we did in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. So, even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning that they have lost all of their natural teeth, compared to veterans without diabetes. And again, this is an indicator of how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So, just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. Again, reinforcing what we're seeing across the board that chronic conditions like heart disease and diabetes really have an impact on oral health outcomes for veterans, even beyond other contributing factors. So, let's talk about this on a systems level. What we want to highlight here is that this isn't just about poor oral health outcomes or reduced quality of life. Of course, those are incredibly serious concerns. It's also about the broader health impact and the cost of care. So, when dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage were expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So, some of our research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's paying for itself. This is important context to keep in mind. Again, we're looking at the national level ahead of diving into the state level. And I just want to note to keep this in mind as we look at chronic disease trends in North Carolina and consider what solutions might look like there. Okay. So we talked about the rural piece and kind of the fact that veterans disproportionately live in rural areas. So sharing some of that overview here, these are data points collected through research that we did in partnership with CareQuest. They come from Burfus, a national survey of veterans administered in 2021, and data accessed through the VA. So just really looking at how that rurality piece can increase those disparities and problems with accessing to care. Okay, we're sharing this out. The other piece of our research is that as often as possible, we approach our research in a mixed methodology because we find it's really important, especially when we're trying to activate and take our data and move into action of how to increase access to care, that we really tell the stories that connect to the data. We share out the first person impact of what is happening for the people behind these data points. And this is, a working age veteran. This is a quote from a working age veteran in Maryland. unable to afford care, and who's really calling out and asking for help. And we just think that this is important level setting and an important insight into the people behind the data that we're talking about here today. Okay. We will also talk about storytelling and amplifying stories um, as we take action. And so keep that in mind as well as we get to that point. Okay. The data that I just talked about and the data that I'm going to talk about all live on vetdentaldata.org. And so that is a compendium of our work. Our goal at AIDPH is always um, to have our research as accessible as possible, to have it open source, and to be taking our findings and pulling it into tools that are usable by folks who are working in dental public health, working in public health, and working with our communities of focus. And so there are many tools on vetdentaldata.org to include our state profiles that we're talking about today. And I'm just going to highlight some spots on that website that we think also might be useful as you try to pull the data into your work. So this screenshot here is showing some of the interactive insights on rural veterans, cost of care, and state-based indicators, which can be accessed on the website. We have an entire tab dedicated to rural veterans. And while the data aren't available from MEPS's medical expenditure panel survey, they're not available on a state level, but they can be evaluated by region. So you can get a sort of proxy for state level data with this interactive dashboard here. And when you click on the rural tab, it will take you to the interactive dashboard on rural veterans across each indicator. It's really clear to see that rural veterans delay dental care due to cost. They spend more out of pocket on dental care, and they struggle to find accessible locations for dental care. Okay. The other piece is that rural veterans feel more impact from lack of access and utilization of dental care. They often cite that the state of their mouth or teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with functional dentition, which likely leads to the data points we're seeing around increased cost of care and higher emergency department use. Okay. Again, this is a screenshot of some of our publications on veteran oral health and highlighting where this information is coming from. This is all publicly available and available on vetdentaldata.org. Okay. So, to kick things off, if you have not already taken a look at your state profile, I invite you to pull it up so you can go along with it as we talk about North Carolina and what's happening in your state. If you want to pull up that now, you can, I think Sheila probably put vetdentaldata.org in the chat. You can click on that. You can go to the interactive map and hover over North Carolina, or you can go to publications and put in North Carolina and pull up your state profile. Okay. So we're about to get to the good part and look at your state, but before we do so, we're gonna do a quick pause, let you stop hearing my voice for a minute and hear from you. I would love to hear one word, what you think your state's biggest challenge is for veteran oral health. We're gonna do that on Slido. So again, if you close it out or don't still have it open, you can scan the QR code or pop the website in here. Navigation, access. I'm making an assumption that the navigation piece is kind of the system and making appointments and kind of that intersection of insurance and appointments and wait time and how to figure all of that out. But if I'm not naming what that means, please feel free to correct me in the chat. Lack of awareness. So that could tie into that health literacy piece. I think the other piece we hear about with awareness is if there are care coordinators in your state, if they understand where veterans can get care, if veterans understand where they can get care. So again, kind of connecting all into that literacy piece. Cost. I see people double tapping, triple tapping on cost and access. Okay. Okay. This is going to stay up and active. So we have probably gotten, trying to look here and see, probably less than half of folks have responded. So if you have not yet responded, please do so. We want to hear from you and understand kind of your pain points in your state. I'm going to go back to slides, but this will remain open and you can always access it through the chat. Okay. So again, we put these state profiles together to answer the question that we were getting when we were working on veteran oral health at the national level, and that was, what does veteran oral health look like in my state? And once we put those profiles together, we put this road tour together to share out the tools and resources that we have available for folks at the state level to use. But this seminar is just as much about listening and learning from you. You know North Carolina best, your data, your context, your communities, and your insights really help us improve these profiles. These profiles are a few years old at this point. So in 2026, we will be reviewing the data and updating them, making sure that the numbers are up to date because we see them as an important resource for folks. So please, again, feel free to share, go back to those Slido polls, post in the chat. We pull all of this information from our seminars and the feedback that we hear from folks at the state level and pull it into a compendium report. Also, if you are curious about what is happening in other states, you can access our summary report and look at those conversations that other states are having and success stories. I'll talk a little bit more about that at the end when we talk about next steps. Okay.
I just wanted to interrupt real
Yeah.
quick because we had one more answer on Slido, and I think it's great. It's access to a provider that takes their insurance. So it's like, we know access is a common issue that we see, but it's like, even if they do find care, then they have that extra barrier of, well,
Right.
now they don't take my insurance. So I thought that was a great thing to highlight.
Yeah, that's fantastic. Well, it's not fantastic that it's helping, but it's good insight. Thank you. Okay. So taking a look at the profile, if you've taken a look or you have it open, we start each profile with some quick context, what's happening in North Carolina and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So again, just like we kicked off this seminar talking about the key points that most veterans are not eligible for dental care through the VA, that's where we really start those state profiles because again, it's something that we find that many people, policymakers, funders, even oral health folks don't realize that most veterans are not eligible for dental care through the VA. We find that a lot of folks think that's where they get their health care, so that must include dental. So when you're starting a conversation, it's a really powerful place to begin, that veterans often don't have an option for dental care, and that leads to some gaps, right? We've also included data on where veterans live across North Carolina, especially counties with high concentrations, and pulled in whatever we could find on rural veterans. So there's a full map you'll see here that you can kind of break down. And then this is the top counties with the highest veteran populations. So that can kind of really give you a quick understanding your state and locations and counties of what's going on for those veterans and what services might be available or not available in those counties with those high concentrations. So right up front, we hope this gives you kind of useful county level insight to support better informed local decisions about how to deliver care and improve access. So here we compare North Carolina to national averages because without that context, the numbers really don't mean much, right? If you're sharing this with a policymaker, a program leader, they might not know if 10% is high or low or somewhere in between. And that's again why we kind of set this up in the national context to help you quickly see where North Carolina stands. You can also compare. Something we recommend is comparing across states if that's helpful to you. So some states have similar challenges or demographics. And as someone working in North Carolina, you probably know which states make the most sense. We find often, particularly when we're talking about those rural communities, if they happen to be on a border, often folks are working kind of cross border, across states. Clinicians often have dual licensure. Kind of those pieces come into play. So it can be really helpful to pull up a profile of a state like that and understand what's happening there. Um, and look and maybe they need help or maybe they have a success story that they can share. So earlier we talked about chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking with decision makers or planning programs. So again, these profiles were designed in a very visually appealing way, a way that can be easily printed, so you could literally take them to a conversation you might be having with someone in your community. So here you'll find data on heart disease, diabetes, insurance status, and indenturism, all compared to national figures. Um, and also just kind of highlighting here, they're assigned from number 1 is the worst and number 51 is the best by comparing all veteran status across the 50 states plus Washington, D.C. So that kind of gives you a reference point. The higher you go, the better. The lower you go, the worse. So kind of giving you some reference for those numbers there. If you're interested in doing a deeper dive on the technical part of the research behind the rankings, et cetera, that is detailed in the methodology section of vetdentaldata.org. Okay, so then we get to the grade. And again, understanding we took a report card approach, really looking to have something that was kind of a quick snapshot. Everyone can understand. The majority of folks have received a report card. It's a really easy to understand frame of reference, which is why we took this approach. So we see the grades individually given for diabetes, rates of uninsured, and dental visits, the percentage of veterans in North Carolina that visited a dentist in the past year, and then those combined for an overall grade. And so what I want to point out here is you guys have a great range. And I encourage you to not only look at the areas where there's a lower grade and a need for improvement, and that might be kind of the obvious place to look in the first step, but really taking a look at your state, where is it succeeding, and exploring why and how you got there. Are there programs in place that allowed that higher grade? Were there specific public health initiatives that were taken to get you there into that part that is successful? And same point, if you are comparing to other states, take that same tactic and look at where they're successful. If you have colleagues in another state and they have an A in an area that you might have a lower grade, maybe talking and looking into how they got there can be helpful in thinking through a path forward. Okay.
Liz, before we move forward, I
Yeah.
just wanted to highlight one.
You want me to go back?
Oh, no, just to highlight, I'm so sorry, one comment in the chat.
Oh, perfect.
Yeah, Kristen stated that the dentist that she spoke with cite that a shortage of dental hygienists limits how many patients they can care for, and that the shortage is especially true in subsidized dental clinics, which I think we're kind of seeing nationally. And Kristen, not to put you on the spot, but if you would want to pop in the chat or even like come off mute, and did they discuss maybe what barriers they are experiencing? Is it because they maybe can't provide as much hourly wage as private sector counterparts, or just maybe any barriers that they may have stated is the reason for that shortage, or is it just across the board, public and private sector?
So that was definitely a wage thing, and just there are not that many graduates coming out of dental hygiene training right now, and they're having to compete for these clinics that are able to pay so much more.
Yeah. Sheila, I don't know if you have further commentary. So Sheila is a hygienist herself and an instructor. Um, I think that that's, you know, the workforce issue we're seeing across the board, and kind of thinking through what can we do at the recruitment level? What can we do at kind of the professional development support workforce level? And then kind of more that systems level for the wage piece. Shayla, I don't know if you have other thoughts.
No, it's just such a barrier we're just seeing. And at the end of the day, like we can understand both sides, right? I mean, of course, these new graduates, they have debt. But something else that I've really been interested in when I look at not only dental hygiene programs, but dental programs is just really the lack of education that we get on public health, or really anything outside of a clinical setting. I know really in 2007 when I graduated, I knew I could maybe go into a few other directions, but like we really didn't hit those programs are why they're important. So I know at UC where I'm an instructor, they really are trying to integrate that public health piece more, even policy, which is something that I'm very interested in just because we don't talk about that, or at least I didn't when I was in college. And so just maybe adding that piece is something that we really need to look at in the dental field, like why it's important. Yeah, even financially, it definitely is always going to be a high barrier. That's just always in public versus private sector. And I don't really think that's going to go anywhere anytime soon. But if you don't know about it and you don't understand why it's necessary, or what we do with that information, and why research is important, and why it's important to be involved in policy decisions and not just in the clinical operatory, then we really don't stress that. It's like we're always going to have that gap in care, I feel. And so it's great to hear that. And that's why I've really just been hitting that hard recently myself, looking at data. Just like I said, it's a national issue. And it's just so many students say they're just not informed, or they just weren't taught why it's important or why they should go that direction. So it's very interesting. Thank you so much for sharing that.
Thanks, Shayla. I will also say we'll talk in a minute here. We have some slides on the work that we've done in Iowa. We have had the privilege of doing a deep dive on veteran oral health in Iowa, doing place-based work for going on 3 years, going into 4 years now, that started with research and then went into stakeholder conversations, ultimately leading oral health stakeholders in the state through strategic planning, and now getting their oral health coalition into action on that strategic plan, developing out an advocacy toolkit for them of how they can approach. And that could be a whole seminar in and of itself, but I'll share the resources for that page. I say it because folks who were involved or are involved at the hygiene school and the Hygiene Association have been involved in those conversations and having strategic conversations about how they could integrate the schools into the issue of veteran oral health, and really making kind of connections there. So if there are instructors, if there are hygiene folks that are interested into looking into that, I encourage you to take a look at our Iowa work, which is also all on our website, and I think vetdentaldata.org. We'll talk about that in a second. I'll do a final quick piece, is that we have a lot of free resources for folks at the education level to have an eye towards that public health mind. It doesn't solve the problem that they should be paying getting higher wage, but really getting folks interested and understanding the pathways, how to pursue those career pieces. Yes, Iowa work. Yeah, in the chat. Okay. This is just another screenshot of one of the interactive dashboards on vet dental data. We kind of talked through that comparison strategy, which you can look up a specific state and pull up their full profile. But if you want a really quick snapshot, you can go to this map function on the website, hover over, and it will pull up kind of those initial pieces, which might give you a faster, quicker, easier way to get to what seats you should be looking at for lessons learned or comparison. Okay. So we've been working on Slido, but we're going to go over to the chat here. And I kind of given all this, we heard about the hygiene, so this might have been part of it, but we would love to hear Data only tells us so much. We know our surveillance systems are limited, our access to data is limited. So we've done as much as we can with the data that's available. But what barriers are you seeing in your work that you know are real for veterans in your community that aren't reflected in the data we just discussed? Um, would love to hear that and have a conversation around addressing that. And I should also say I have a double screen, which is why I'm kind of looking and I'm looking over here in the chat, but I'm looking away from all of you because it's the opposite side of my camera. Okay. I will give folks some time to chat. And Sheila, I'm going to talk about using the profiles, and we can kind of circle back as you're seeing pieces pop up in the chat. Okay. All right. So again, I hope that that information was informative. We really want you to come away from this session with next steps and how you can leverage understanding these disparities, and our tools, how you can leverage the tools in the work that you do. Okay, so we're going to talk about some ideas of how to use the profiles. Veteran advocacy. I've talked about advocacy a few times, and I just want to point out that advocacy can mean many things. Sometimes it means legislative advocacy and talking to legislators at the state level, at the national level, but it can also mean really just sharing out, amplifying an issue with your community, with your colleagues. So don't be intimidated. Is my point of kind of sharing kind of the different levels of advocacy. One of the most powerful things we can do with data is advocate. It can look different again on your approach, on what your role is, who you are in the state. But the profiles really give you credible local data that you can bring to folks in your community. It might be a city council, it might be congressional reps, it might be other nonprofit organizations or mission driven organizations. Okay. You could do something like organize a listening session in your community and invite decision makers. Use the data tools to do your own presentation. Okay. So again, many people working in healthcare, many people working in veteran services don't know how stark the oral health gap is. They might, I think, don't understand that they can't access dental care through the VA. And then I would also argue that folks who are not steeped in oral health don't understand kind of the connection that is so obvious to all of us of that systemic oral health connection. And that's why education is so important. So we hope that you could use this profile. Again, you could lead a short talk at your organization's staff meeting. Maybe you do other volunteer work and already have kind of a partnership with another organization that you could share out this issue with. Really, when stakeholders are informed, they become allies and activated, and that's how we build momentum around an issue. So again, it's an opportunity to collaborate across silos. So maybe you're bringing this issue to someone in housing, maybe mental health, food access, maybe transportation. Maybe there's other organizations out there who are doing transportation work for other things that could integrate into helping folks get to appointments. Informing strategic decisions. So data is a tool for strategic thinking, whether you're leading a nonprofit, managing a health program, or advising on policy. You can use the profile to help decide where to focus. So maybe it's a literal where, maybe there's a rural county with no dental providers. Maybe it's one of those counties that has the highest population of veterans in your state, and you're understanding where to implement programming. But it might just be aware of an issue area. So it might be a lower grade on your state profile, and that's going to be where you start. The other piece is that the data can help you make the case for is where you are. To that point, we hope that this could potentially help you get funding. How the data can help you bring in resources. So grant makers and funders want to see data. They want it grounded locally and in the community. And our hope is that this profile gives you a start for that. You can use it in your problem statement of a grant request. You can use it to show gaps in care. You can also cite it as the foundation of what your solution will address and as a benchmark if you are measuring outcomes and deliverables of a program that you're proposing to implement. Okay. I'm going to skip us over to this poll in interest of time. So again, if you have Slido still pulled up, if you could pull that up. Again, hearing from you, our goal is to take our research and develop out resources that serve our field, serve folks working to advance oral health. And so we would love to hear from you about what additionally would be helpful. Would it be education materials, policy briefs, research findings, training modules? Just take a second and pop that in there. Training modules. I'm going to take a stab and say that I'm going to make an assumption that that connects to the health literacy piece. Education materials. So I'm seeing a lot of connection there. Okay. And if folks want to share in the chat, if they have specific groups, organizations, populations that they think that those education materials would be helpful for, please let us know in the chat. And please continue to respond even as we go to some other slides. So I mentioned that we were going to share out some success stories from other states. And so this is a spotlight of some of those success stories. Some ideas. Florida passed legislation that created the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. The program was designed to provide dental care to veterans living in Florida. The department partners with a statewide direct support organization to administer the program. And that organization then distributes grants to nonprofits with a strong track record of serving veterans. And then those nonprofits deliver care to eligible veterans based on income, service history, other qualifying criteria. This was newer legislation. I think it was passed either at the end of 2024 or beginning of 2025. The program was implemented in spring of 2025, and I think we were hearing maybe midsummer that it had been successful thus far, and they're going to continue implementing it. So it's a new and emerging program, a pretty innovative approach. So it's kind of a shout out to Florida, and keep an eye out and from a case study perspective to see how that's going in Florida and if it's a replicable model. Oregon also has an innovative solution. They developed a Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either. And then if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics partnering with the program. Iowa, I mentioned, and we have some slides on coming up after this, but their state uses lottery dollars to fund the Veterans Trust Fund. And that fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. The fund also can fund many other things as well. So it's an interesting program. And we just published an entire toolkit for advocacy and activation around that trust fund, around how stakeholders in Iowa can advocate for kind of some rule changes, some policy changes that might increase funding for the trust fund, that might change the rules on some of the pieces and relieve some of the pain points to make it more streamlined. So if that's something that is of interest and that policy, that program sounds viable, again, there are many tools, resources we have from our work in Iowa. Again, we had the privilege of working kind of in a really deep, concentrated manner over many years in Iowa. So we highlight it. Their trust fund is really innovative, and it's an interesting way to provide care. And also, they're a great example of if a community is activated on veteran oral health, kind of what they can do and where they can get to in advancing veteran oral health in their community. Okay. I see something in the chat. So I'm
Yep.
looking.
Okay.
Working age veterans will also be included. That's over 65. Periodontal disease researcher. Alzheimer's well known. We all know that memory care is shockingly expensive. Perhaps linking dental coverage to delayed need for memory care will be a way to demonstrate to policymakers that dental access is a priority. That's a really great point. A couple things. So we are redoing the state profiles as is, with updated data on the numbers that are there. So I don't know, not being on the research team and being one of the researchers doing that, I don't think the intersection of those data points exists the way we have it now. However, I believe that we are starting a separate research project on aging veterans, that I think might go in this direction, looking into this piece. We had kind of done a lot of research projects on veteran oral health, and we're working to get it out to the community. And now we're kind of saying, okay, based on community feedback and what we have, where else do we need to look? And aging veterans is one of those places. So I would say stay tuned. That's an incredibly salient point and something that I think our research team is diving into in 2026 outside of the state profiles. And also, again, I like the systems thinking of making the connections with the cost of care. Um, yeah. Okay. Any other questions or comments? It can be. Oh, okay, awesome. Thank you, Kristen. Okay. If a question occurs to you, please chime in the chat or hand raise. Okay. We talked about leaving you with a call to action. We talked about how to use the state profile. That can be a lot. I hope everyone here is feeling activated around the data we went over, but I also know it's a lot of information to take in. We're all very busy. We're headed into the holidays. So I'm leaving you with one very concrete, easy step to take after this session to keep our momentum going. And that is to share the state profile with one new person or organization. If you are willing to post in the chat who you're going to share with it, we would love that so we can hold each other accountable, keep each other engaged and encouraged. Share out with a colleague. Over the next few days, Shayla will be sending out a follow-up email, sharing out that the recording is posted. If you have a colleague that you think would benefit or be interested in the seminar, you are able to share out the recording with them. They can get CEU, watching it asynchronously, with colleagues at PO. Okay, great. Fantastic. The other piece I will share is that today is actually our last day of Veteran Oral Health Week. We host Veteran Oral Health Week every year, and it is a way for us to amplify this population need, to share out the resources and make sure that we're hearing from folks about what is going on in their communities with veteran oral health. So take a look at our LinkedIn, scan the QR code here, take a look at our website. If veteran oral health is something you're wanting to move forward and find more resources on, we have a whole page on our website, Vet Dental Data, and you can kind of go back to our LinkedIn and see how we're walking through folks of how to access those resources this week. Okay. Some logistics next steps for everyone. CEU is available for today's session. You need to have attended the entire session to obtain CEU. Shayla just put that link in the chat. They are on our academy. So if you have not signed up for our academy, you'll need to set up a username and login. There will be an evaluation and a request. If you are not looking for CEU, we would still love for you to take the evaluation and let us know. We are always looking to hear from the community of how we can improve our programming. So if you're interested in completing the evaluation but don't need CEU, please feel free to do so. Again, recordings and resources will be posted from today's session. We talked about story gathering about veterans. It is an important part of our advocacy work to raise the first person experience. If you yourself are a veteran or you know a veteran who has an oral health access story, please consider sharing our storytelling form with them or completing it yourself. It is completely anonymous and really helpful in ensuring that we can lead from behind and raise our veterans' voices. Okay. I also mentioned our summaries. So we have just published maybe a month or two ago, kind of our compendium report from this virtual road tour series, and it is a living document because our goal is to get to every state in the country. After every session, we will pull a summary of the stakeholder conversations that happened from each state and post those. So again, if you're interested in understanding what's happening in other states, you want to go back and look at a summary from this conversation, you can do so at that resource, and Shayla shared that in the chat as well. I am going to pause for a second and hand it over to the coalition so we can hear about some opportunities for activating at your local level.
Absolutely. Good afternoon, everyone. Thank you so much for joining us. It was a pleasure having AIDPH with us today to present all this great information. Just want to take some time to dive in on NCOHC, North Carolina Oral Health Collaborative, and the work that we are doing around advocacy for access to care, policy changes, and also workforce and improvements for our oral health careers out in North Carolina, specifically over in the Western North Carolina is where we are working right now, but would love to make sure that we are looking at other areas of the state as well. So I wanted to share this information with you guys on the work that NCOHC is doing. Please feel free to check us out on our Facebook, LinkedIn, and also on our website as well. And you can find that at the QR code provided here. Thank you so much, Liz and Shayla.
Yeah, thank you. And thank you again for bringing everyone together here today. So without further ado, I will leave everyone with veterans deserve equitable oral health. And I thank you for being a part of that, activating on this issue by being here today. We are available for questions and follow-up via email. Take a look at the Academy for your CEU and let us know if you need anything else. Thank you so much, everyone.